All right, everybody. Good morning. It's Dr. Arafij from Vet Triage, Monday, November 4th, 2024, 9:28 a.m. Pacific time. We are going through this issue of JAVMA. This is the May 15, 2018 issue, and we're talking about this special report, an executive summary of the Merck Animal Health Veterinary Wellbeing Study. So let's get into it. This is, of course, one of the goals of Vet Triage to improve mental health and well-being in our colleagues. And this is 2018, so pre-pandemic, and the numbers I think have gotten worse since this report. But let's talk about it. Mental distress, suicide, compassion fatigue, burnout, other forms of job stress. The three main goals of the Merck Annual Health Veterinary Wellbeing Survey was to quantify the prevalence of mental health among the veterinarians and compare the prevalence with the prevalence of the general U.S. population of adults. We wanted to figure out what factors cause risk for mental illness, determine factors that negatively and positively impact mental health in veterinarians, measure level of well-being in the profession, identify factors that contribute to higher levels of well-being. Methodology, 20,000 emails were sent out. They also had a random drawing for 20 $100 gift cards. The study sponsor contributed $1 to the American Veterinary Medical Foundation for each response received. Mental health was assessed using the Kessler Psychological Distress Scale, which determines the presence or absence of severe psychological distress on the basis of a numeric score. Well-being, which goes beyond the concept of mental health to examine the way the individuals feel about their lives, compared with the best and worst possible lives they can imagine, was also evaluated using an index score on the basis of responses to three questions used for measuring well-being. And I give talks about this, and I've cited this study in my talks as well, pertaining to the Kessler Psychological Distress Scale. There was a response rate of just under 18% for the study. Key insights from the study: high student debt levels, as indicated by 67% of vets thought it was critically important. Stress levels of veterinarians, 53%. Suicide rate, 52%. These are what vets feel are most critical to them in terms of issues. 79% reported feelings of depression, fatigue, burnout, anxiety, panic attacks within the last year. 5% of veterinarians experienced serious psychological distress in the past month. And another study showed 4.7%, so a little about the same. But another study 4.7% for the general population, 5.3% for veterinarians. Another study for veterinarians was very high, 9.3%. Serious psychological distress occurred more frequently in younger veterinarians, those under the age of 45. Only half with serious psychological distress indicated they were receiving treatment. Working long hours, having student debt, being a relief veterinarian, and your personality type contributed to this. 25% thought about suicide, 1.6% attempted. Another study found 1.4% attempted. General population of attempting suicide is 5.1%. Male vets have a higher well-being than those in the general population. Female vets significantly lower than women in the general population for well-being. Higher levels of well-being, factors that contribute to higher levels of well-being include higher income, working less hours, not working evenings, no debt, being an owner of a practice, traveling for pleasure, socializing with friends, exercising, being married or in a relationship. Interestingly, spending at least 1 hour on social media had a negative impact on mental health and well-being. 41% recommend the profession to somebody else, whereas 33% would not recommend it. And the reasons for this were compensation, student debt, the personal toll. Summary of findings. So first, mental health. The Kessler Psychological Distress Scale is validated. It's based on 6 questions. The 5-point scale ranging from none of the time to all the time. Those who are 13 or above have serious psychological distress. 5.3% of respondents had serious distress. The general population, 4.7%. Younger veterinarians were also more likely to have severe distress. Single veterinarians, more so than married. So single, 99.3%, married or in a relationship, 4.5%. Number of hours worked per week, working evening hours, and those are contributed to distress. Serious distress was also common amongst those who worked more or less hours than they desired. The prevalence of serious psychological distress was seen to be low in food animal practice, high in clinical practice. Those who felt they were doing poor financially also had more distress. Veterinarians with distress were most unhappy with their financial situation and their job. 83% with distress would not recommend veterinary profession. Personal toll takes 56%, student debt 50%, low compensation 44%. Now, mental health treatment results. Half of the vets were receiving treatment, 40% for depression, 30% anxiety. As far as the employee assistant programs, only 14% with serious distress said their employer had access to employer assistant programs. Programs are web-based resources for veterinarians concerned with mental health or well-being were only used by 16%. And of those, the AVMA was number one at 64%, VIN, Veterinary Information Network, 31%, Veterinary Medical Association, 29%, DVM 360, 28%, and I'm on the board for DVM 360. Animal Association, the American Animal Hospital Association, 13%. I also helped them as well. And other organizations, 16%. VIN was touted as being the best source, by the way. Only 46% of those with distress agreed with the statement that mental health treatment is accessible. 62% of those without serious distress agree with that statement. 60% with serious distress disagreed with the statement that people are caring towards those with mental health. Among those not distressed, only 37% disagreed, meaning there's a stigma out there if you declare you have mental health issues or you need help. And so people tend not to pursue treatment because they're afraid of being labeled. And then if you spend 2 hours or more, 2 or more hours per day on social media, that also increases distress. Suicide ideation and attempts, 25% thought about it, 16.8% in another study thought about it, 1.6% attempted, another study 1.4%, another study showing in general population 5.1% in the general population attempted suicide. Okay, well-being category. Well-being examines well-being examines how satisfied an individual is with their life and how they believe their life is compared to the worst or possible version of it. They measured this based on 3 standardized questions from 0 to 10. So if you scored 7 to 10, that means you're flourishing, you're getting by. With a score of 4 to 6, you're suffering, and 3 or less. 28% of those suffering were found to have serious psychological distress as determined by the Kessler scale. Veterinarians scored only slightly lower in well-being than the general population, with a lower percentage of veterinarians flourishing and a higher percentage suffering. Male vets have higher well-being, married vets have higher well-being, older vets have higher well-being. Veterinarians who were not in clinical practice scored higher than those who were in clinical practice. And among practice type, food animals scored the highest for well-being. As was the case with serious psychological distress, student debt was correlated with having lower well-being. Completely dissatisfied with your financial situation, 69%. Dissatisfied with your job, 68%. Personal income, 57%. Household income, 53%. Factors associated with high levels of well-being include higher income, working less hours, no debt, owning a practice, not working evenings, participating in healthy activities like traveling, reading, family, socialization, hobbies, exercising, and being married or in a relationship. Finally, the attitude towards the profession. 41% said they recommend the profession, 33% would not recommend it. When you look at the general population of U.S. adults who are working, who have a job that requires at least a college degree, 70% would recommend their career. Amongst physicians, 50% would not and 50% would. Younger vets were less likely to recommend. Only 24% of veterinarians less than 35 years of age and 31% of those between the age of 35 to 44 would recommend it. When you look at the general population, younger adults are more likely to recommend their career at 82%. Low income, which is 54%, high student debt, 53%. Those are reasons why you won't recommend it. And the personal toll, 44%. Conclusions. The percentage of veterinarians who report having attempted suicide at some point in their lives was lower than general population. As far as recommendations go, as is the case for physical health, the primary responsibility for good mental health falls on the individual. I'm not sure I agree with that. If we're going to view mental health as being a societal issue, it's a community problem, and it's encroaching onto the workplace, then it may be actually society's responsibility as well as the individual. And more specifically, if it's encroaching onto the workplace, or the workplace is the source of your mental health issues, it probably is a responsibility of the institution. So I'm not really sure I agree with this, but I wonder now after COVID, and with these numbers I think have gotten worse, if that attitude would change. Given the higher levels of stress inherent to the veterinary field, they recommend consulting with a social worker or a mental health professional, maybe also talk to a certified financial planner. Employers of veterinarians should provide time off meetings for mental health and also for financial planning. Employers can help educate veterinarians on resources, and limiting work hours and evening hours can also help. It's interesting with the time off for mental health, because now we have mental health days. And so I wonder if this study brought about that change, or at least contributed to it. You used to never hear about mental health days until now, which is different than like having a sick day, I guess. Veterinary medical colleges and veterinary organizations continue to seek ways to lower costs and subsidize veterinary education through scholarships, low or no cost loans, loan forgiveness, other support. All or nearly all veterinary medical colleges in the United States employs mental health professionals to provide assistance to students and faculty. They want that extended to alumni as well. We should also be exploring innovative methods such as telebehavioral health solutions to make access to mental health flexible, inexpensive, and efficient. So that's the study. The same sort of grim numbers that we typically see. You don't get into the veterinary field because you want a desk job. It's not a 9 to 5. It's gonna affect your personal life. Clearly, it's going to affect your personal life. There are factors that you can use to mitigate it. For myself, owning a company who's 24/7 and not having any work-life balance, I definitely try to commit and hold to those time commitments for things like friends or family or the gym, things like that. It is imperative, and no exceptions can be made to avoid those things. You can't skip out on them. We have to have that balance. So hopefully this helps, brings light to this stark situation. We'll see you guys tomorrow for another live stream. Thanks for watching. Bye-bye.